Good evening. This is my final discussion. This week's discussion is Winners Therapy Group considering implementing virtuality into their therapeutic practices and discussing some of the pros and cons, some of the risks with VR and therapy, and any advice I'd have for the company as a cyber psychologist. One of the most important things I would bring to the table is making sure that all of the staff has proper training and is well educated on the virtual reality tools that will be implemented. I think that is one of the biggest things, is making sure that everybody in the practice is aware of how to use them, so that way we are optimizing the use. Secondly, one of the risks for virtual reality and therapy is disruption with the eye, like too much screen time can be a little bit harsh on the eye for some people. So I think making sure that therapy sessions are having a cap time, that we're not going over certain times, 45 minutes to an hour, and how often the patient will be coming in for therapy as well. When it comes to a soft launch of this program, I think that it's extremely important that there are waivers given out to each patient. Each patient is properly debriefed and informed of what's going on. But I also think that there should be a pilot session where each of the VR tools should be used on the staff. I think that the staff will be better equipped and well known with the technology if they're utilizing it themselves. So having a pilot session where each person in the practice has some time spending with the tools, experiencing it, so they can also relay this information to their patients. If patients have questions about using virtual reality in therapy. But I do think that it could be very beneficial, especially if you're dealing with different patients who are trying to overcome PTSD or certain other things that they need to kind of be in a situation where they could possibly and safely reenact the traumatizing or conflicting moment in their life.